Okay, here's a big question that you've got, probably that's why you're watching this video. Can I reverse my type 2 diabetes diagnosis? The answer is yes, and the answer is no. Let me explain. Yes, you can put your diabetes in remission, which means you may not have a need for medications, or at least very few. But two, no, that diagnosis is there because even if you get to normal weight and start doing everything right, there's a chance it could creep back in years later. And because you've been diagnosed once with type 2 diabetes, long term you want to make sure you're following through with your doctor and say, look, that's gone, that's part of my past. No, there might be some complications that are going to haunt you later, so you want to make sure that you consider getting your type 2 diabetes into what they call remission versus trying to say, I got rid of it. Because unfortunately, that's not what the experts are saying. They like the term remission, and I think that's totally right on track. So what is remission? Remission is getting your type 2 diabetes A1C number down below 6.5 for 3 months or longer. That means that you've gotten down below the range of type 2 diabetes. Now you're considered pre-diabetic. If you can get it down lower than that, all the better. But here's the point. Until you do that, you're really not considered to be in remission. And after that, what's going to have to happen is now we're going to be checking you once a month to make sure it doesn't return, because with age, it may down the road come back. Doubtful if you take care of yourself with a lifestyle modification that I would consider, some people would consider drastic, which means you got the normal weight and you exercise on a regular basis. So remission, yes, possible. Here's a study I want to go through. I got to look at this real quick because this is a podcast, but it's also a video, and I hate to be looking off screen. But the direct trial they did, it was back in the United Kingdom, and it was 146 people with diagnosed type 2 diabetes in a primary care setting were put and said, look, we can try to help you, put your diabetes in remission if you go through and you follow a plan for weight loss and for diet. And within 1 year, 46% of the 149 people had put their diabetes into remission with lifestyle modification alone. Now think about that. They did that with lifestyle modification. They put their diabetes in remission. Now, here's the thing though. After 2 years, only about a third were still there. Why? Well, they got put in remission because they dropped an average of 33 pounds, the people that were in the study, but then the ones that fell out were the ones that after the 2 years went back to some of their unhealthy eating and put weight back on. 80% of people who lose weight will regain that weight a little bit more on diet plans. So it's very important that you understand that you really, if you're going to lose weight on a commercial program, it's a great idea. I did it. I was able to drop 30 pounds in about 4 months. I think it was more like 35. And after that, I said I'm never going back because I learned how to eat right, but also I said I'm going to have to start doing some things different if I'm going to maintain normal weight. So here's the thing. You really want to think about dialing in to getting into remission. Then there's 4 tips I want to give you, and then we're going to land this plane, and you're going to have to decide if you want to be one of the ones that has the holy grail of having your type 2 diabetes put in remission. And I want to refer you in the blog, and at the end of this video, there's a reference to a Time Magazine article that I thought was phenomenal. It was a really dramatic case of a guy who lost 60 pounds to put his type 2 in remission that was very severely impacting his health. And he did some drastic lifestyle changes, and all he does now is preach. He says, look, I had to make some big changes in my life, and it was so worth it because he saved his life in this case. So it's a great article. But let's talk about the 4 things. Number 1, if you're going to do this, you first and foremost have to decide that you're going to stay really tight with your doctor and schedule probably more visits and more follow-ups and more labs for a while until you can dial in that you're treading in the right direction. And then after that, you're still going to have to say to yourself, I got to be committed to having regular visits and to keep track of this. And you may have to do some things yourself to make sure you're on track with some testing. But typically, once you get there, as long as you're vigilant and as long as you stay tight with your doc, you're going to be okay. So he's going to do labs, he's going to do a lot of things. Number 2, you really got to take a hard look at, if you want to get into remission, first and foremost, getting weight loss. Now, the study that they did, the direct study that's in the Lancet that I referred to, 2018, Diabetes and Endocrinology Lancet article, did mention that the people that did this, they lost 33 pounds. On average, that got put in remission. So they did a weight loss program. They said to themselves, I'm going to lose weight, and it was specific, it was driven, it was monitored. And I just got to tell you, personal experience only, I was only able to go from a BMI of 30 down to 25 because I chose to follow a weight loss program commercially available that was designed to burn 1 to 2 pounds off per week. I had to lose 1 or 2 pounds per week to get to my goal in 3.5, 4 months. And I did it. And I dodged the bullet of pre-diabetic to not become a type 2 diabetic. So I have personal experience with this. My wife and I also teach it. Rx Healthy Habits is one of the things we do. If somebody says, look, I'm sick and tired of being sick and tired. When the student is ready, the teacher will appear. Well, we're there for you when you're ready. But anyway, diet. Also, your dietary change, what you're eating, lower carbs, more whole foods, more fruits and vegetables, more protein, a lot less high glycemic foods. That's very important. There is a whole thing on our blog. It's called a diabetic-friendly diet plan. And basically all it does is say you have to change the way you're eating because you can't go back to what you're doing before. So weight loss, very important. Substantial weight loss, yes. You can do it with 5%, but you're not going to go into remission. All you're going to do is make your disease more controllable. 5% weight loss is good. 5 to 10%, not saying that. It's great. It's not going to be enough if you really want to put it in remission, to be honest with you. Okay, so weight loss and diet. Second thing. Oh, I'm sorry, this is the third thing. The first thing was making the doctor points. The second thing was the weight loss and diet. Third thing, you got to get more physically active. And the CDC says 150 minutes per week. That's a good start, and I recommend that. Start doing things that are simple. Start walking, brisk walking. You want to start out slowly. But 150 minutes, so if you really think about that, that's about 30 minutes 5 days a week. That's good. Now, I really think from there, you need to think about getting into more vigorous, moderate to vigorous exercise. What do I mean? Well, I think you're looking at more like 300 minutes. That's what's really going to put you over the top because it's going to help you with weight management much more. And also, it's really going to give you so much more stamina, so much more energy. I highly recommend it. Not everybody's going to get there, but I'm going to say that's your goal, all right? So you got to get a lot more physically active. You got to get into a routine every week that you look at the exercise as part of, I'm serious now, this is your treatment. This is your medication. Your medication, if you want to call it that, is your exercise and your diet plan. It is the way that you manage the disease. Does that make sense? Because I think it does, and it worked for me. And then the last thing, I guess, number 4, is you really got to say to yourself, okay, I am not going back, and I'm committed to this being the lifelong process that I'm going to control this disease. Because unfortunately, you're not going to lose a diagnosis, but you can say to yourself, it's not going to rear its ugly head again. I got it controlled. I am going to take care of this with lifestyle management. I am going to change the way I live. So, hey, listen, we're here at Rx Healthy Habits to help you. We have so much information on this topic. We have information on exercise. We have information on weight control. We have information on weight loss. We have information on healthy mindset habits. We have so much on our blog. It's all on our website, RxHealthyHabits.com. And also, we have a newsletter that comes out once a week. We're here to help. We believe, my wife and I, Elizabeth, that this disease state is one of the most controllable ones out there. And yet, right now, it's taking 1 out of 4 healthcare dollars. And 1 out of 10 people in this country are type 2 diabetics. 1 out of 3 have pre-diabetes and don't even know they're heading that way. So this is a pandemic, I guess, if you want to call it that, or endemic, whatever. You can use the term. I think we have to be on top of it. And if you're ready, we're here to help you, so reach out to us. And with that, I hope that you say to yourself, you know what? I am going to do it. I am going to fight this disease back, and I'm going to put it in remission because it can be done.